Hello everyone and welcome to Fever FM. We're here again for our Together We Can project, which is brought to you by the National Lottery Community Fund. Today we will be discussing mental health with Arfan, who is the Operations Director for an organisation called Touchstone. Firstly, can you tell me about your role within Touchstone and a little bit about yourself?
I'm currently one of the Operations Directors at Touchstone. I've been there for nearly 8 years. A bit about Touchstone. Touchstone's been going for about nearly 40 years as an organisation, so it's a charity. Its headquarters based in Leeds. What Touchstone does is primarily provide mental health and wellbeing services, and it's anything from the preventative side right up the high intensity level where we work with people in hospitals. And we currently have about 250 staff, and we're supported by 100 volunteers. And in terms of our black minority ethnic makeup, a third of our service users are black minority ethnic, and in terms of our staffing, it's around 40%. So that's a bit about Touchstone, and my role in that is to support the managers and their services to meet our contract targets, but to ensure that our services meet the needs of our service users.
What has been the impact of the pandemic on mental health, particularly within the South Asian communities?
Well, the pandemic, apart from the physical health issues of the COVID-19 virus, it's had a very adverse impact in terms of mental health, and the impact we're only beginning to really realise now. The impact is likely to be long term, and what we've identified across the board, people are feeling more lonely, feeling more isolated, feeling detached from their work and social networks, which are crucial to keep your well-being well. So there's been a rise in demand in terms of referrals and support, and one of the things we've done in Touchstone is something called Touchstone Loves Food, where we recognise very early on our clients, apart from their mental health conditions, even have food. There was food poverty and the impact that has on people. And in terms of the South Asian community, it's well documented now that the pandemic itself has had a disproportionate impact, and some of the early reports and data, for example, 60% of all the NHS staff who passed away early on were black minority ethnic, and they only account for 20%, and in that proportion is a huge proportion of people from a South Asian background. So there's a clear documented evidence there is a disproportionate impact on particular communities, and there is evidence that the South Asian communities more likely to be hospitalised and more likely to die, and that in turn starts to have an impact on people's well-beings around fears, anxieties and so on. And the double whammy is the impact economically. Many in the South Asian communities are self-employed, taxi drivers, hospitality and so on. When you start losing job, your money, that then has an impact on your well-being in terms of mental health. So in particular for the South Asian community, it's been a double whammy. So the physical impacts of COVID, we're also recognising the economic impact of COVID, especially in those sectors where the South Asian community is overpopulated, hospitality, like taxi driving and so on. And that's had an impact on families, and where there's less money, then it's obviously had an impact on people's well-beings and mental health. So what's happened during this COVID, if it wasn't for the pandemic, we wouldn't have a new set of service users or clients who otherwise may never have suffered mental health. This is a new cohort of people that are now got mental health conditions as a result of COVID, and I would say it's probably more compounded in the South Asian communities.
What are some of the institutional barriers faced by BME communities when accessing mental health services?
Just want to take a step back. A broader issue is the Black Lives Matter campaign, which actually highlights the institutional and structural inequalities, discrimination, racism that exists across a number of services, sectors, law enforcement and so on. So mental health is no different in that context. And part of it is people of that background are not on those jobs or not in key decision-making roles. So that's just a broader issue, just to understand some of the structural inequalities that exist in many institutions in this country. In terms of the mental health issue in particular, if you look at the figures, what you tend to find is people from a black minority ethnic community are less likely to access primary care services. So that's the primary care services where you go to your GP, you've got issues around depression. But, and this is well documented, when it comes to hospitals, black minority ethnic people are overpopulated, are more likely to be sectioned under the Mental Health Act. I think for South Asian it's up to 3-4 times more likely to be sectioned under the Mental Health Act, and for African Caribbean it's 5 times and more.
I'm wondering if if they didn't miss out the primary step, there'd be less in hospital?
And this is the whole issue here. The problem is there are some barriers in primary care. You've got this client group which is overpopulated, where there's no choice, where there's a bit of enforcement. People shouldn't end up in hospitals. If there's a preventative way of doing things, it saves a lot of money, but also it's better for the individual. For South Asian communities in particular, is to recognise the importance of preventative and what can happen in primary care. And some of the barriers, the obvious ones, people always say, oh, it's language. That's a usual thing that often people say. But I think it's far more complicated. And I think one of the reasons, part of it is the organisations who deliver these services are not necessarily representative of the communities they serve. And in a way, why we do it in Touchstone is not because we've got very good strategies, is our workforce is representative of the communities that we serve, and that's really important. And if that's not there in the first place, no matter how good your strategy sound, it's going to be quite a challenge. People end up seeing CBT therapists, which are cognitive behaviour therapists. You're more likely to see a white person. Yeah, and people will not see someone from their background. There's issues around barriers related to people's cultural needs, and for example, for Asian women, in particular Muslim women, it's gender specific. There's certain days of the week where certain faith groups, that's their day off, and services still hold appointments on those days, or only give an appointment on those days. So these are some of the barriers that do exist. But also, I would say the whole institutional way the system is operated, it's not person-centred sometimes. It's not centred to the person's cultural needs, or doesn't take into account what their faith is. Things are improving, but there's still a long, long way to go. And until there is representative workforce across the mental health system, I think there's always going to be institutional barriers for people from black minority ethnic groups going into mental health. But also the fear, because it's still part of the state. Ultimately, when you get sectioned, you've got less rights compared to you being arrested.
You touched on it earlier about the stigma. Do you think that stigma and misconceptions within the South Asian community, do you think that's quite high?
I would say there's stigma and misconceptions in all communities, but in particular in some minority groups, there will be particular stigmas, certain views of mental health, which are still valid. I think I need to make quite clear to your listeners that the Western view of psychology is very recent. It's only a few centuries. The idea of what makes people happy or unhappy, no one's really got the full answer. So in terms of, in this country, often mental health is considered as a clinical thing. It's called a mental health illness. And once that's in itself feels a bit of a stigma. And it's recognising we as humans have ups and downs. We have emotions. That's what makes us human. But there is stigma that exists around what mental health is. There are some communities who view mental health not only from a medical perspective, they also see it from a faith perspective. There are certain perspectives around spirits and things like that. These do exist. And for Touchstone, these are still valid views. And so there's fear around that if someone says, oh, someone's hearing voice. And if you put that into the context, say, of a Muslim community, that can mean something completely different compared to if that was presented to a medical practitioner. And both views are valid. So there is a stigma. People might think someone's, in quotes, possessed. These misconceptions still do remain. However, they are valid within the community because it's their truth. As Muslims and many in the South Asian community, we come from a faith background and we do believe things beyond this world. That doesn't make us mentally ill.
No, it doesn't.
It's part of our belief. It's important that practitioners recognise some of those cultural differences, because if someone did present saying, I'm hearing voices, they're likely to be sectioned and not to be considered in the context. Actually, for the Muslim community, it might mean something different.
Can you advise our listeners on how to keep well and how to seek advice should they feel that their mental health is suffering?
The first thing to acknowledge and recognise for everyone is that we're all human. And I say this from experience. From the surface, people think I'm successful, a good job, nice area of Leeds, but I myself have been hospitalised under the Mental Health Act. And I'm open about this because I don't see it as a stigma. And that's one of the first starting points for people. I see stigma as the illness, not mental illness. Stigma is the illness. And it's to demonstrate to people you can recover. If you've got a broken leg, go to hospital. There are things in place, treatment, therapies and so on. So I'm quite open when people think it's certain types of people who get mental health problems or have breakdowns. I'm successful in what I do, worked at a high level throughout my life, but still had a mental health illness, and I still have. So that's the first thing, is to be honest with yourselves. And the second bit is about ways to talk about it. People can talk about treatments and get into isms and schisms about psychological intervention. It's literally about talking, and some of these therapies are called talking therapy. It's in the context of compassion. From a medical perspective, always seek advice from your GP. Your GP is more than just your medical practitioner. He's part of your community, or she or they are part of your community. And always they should know your family history. They should know things about you. So always seek advice. Don't wait like me. I waited and waited to the point I was sectioned. I was in denial. I thought, no, I can't have mental health. So it's just to recognise there are things in place very early on. Through the GP, there are many services that are available. There is medication, but there are talking therapies that are available in the city. And we, through a consortia, Touchstone, also provide CBT therapy. And also we have in the past tailored it to, for example, to the Muslim community, where we felt its benefits. But I think for listeners from a South Asian background, whatever their denomination is, there's a recognition that the South Asian community has a strong faith base. The fact that exists, that in itself can bring solace. And some of the modern techniques that psychologists use and psychiatrists use around mindfulness, these are practices from these Eastern religions and faiths. And all these faiths have one thing in common, is to bring about ease to the well-being of the human condition. That's what they're all about, essentially. I would say to the listeners, always complement whatever's available from a medical perspective, but recognise you've already had the tools and you've had them for many, many years. It's built into our cultures and our faiths.
Excellent, that's really good advice. Thank you for joining us, Arfan, and sharing your thoughts and views, which I'm sure our listeners will find very informative. Thanks again for coming on to Fever FM.